All right, good afternoon, everybody. We thought it might get worse before it gets better, and I'm afraid that we were right. Not happy to announce that we've had more than 200 new infections since yesterday. That takes our total up to 618. Sometimes infections are related to an increase in the number of tests, and that's not the case this time. Infections are related to the fact we have a higher percentage of our people who are actually infected. Fairfield County still seems to be where most of the people who are infected are, about 62% of the total. New Haven, though, more than doubled from a smaller base, 41 to 89. So about 14% of the total are in New Haven County, and another 14% are in Hartford County. And that just gives the rest of the state a little more time to prepare for what will be coming. I want you to know that most mornings I'm with the Unified Command. We do this virtually at this point. But it's over 100 of your commissioners and deputies and folks who are taking the lead. It's public health, social services, education, economic support, public safety, and folks working their heart out to make sure we're doing everything we can to keep you safe. As I said yesterday, we've focused on expanding our healthcare access, healthcare capability, healthcare capacity. I just came from St. Francis Hospital, where the Connecticut Governor's Guard installed a mobile field hospital. They put in an enormous balloon on top of this 25-year-old tent and expanded it out. And very soon there will be able to support another 25 beds there and for intermediate care, opening up additional capacity at St. Francis Hospital. Interested to know that we've got groups now working at Southern and Central State universities, opening up dormitories there so we can have additional capacity. Maybe not necessarily for folks in care, but many cases for nurses or doctors who feel like every day they're on the front lines. Maybe it's not right for them to go home where they worry about infections. So it just reminds you what heroes we have on the front lines. Speaking of folks stepping up and volunteering, I said we also needed more people. And I think last time I said we probably have about 500 nurses who have come in off the sidelines. Now we have 900 nurses and doctors coming in out of retirement, stepping up, ready to lend a hand. And 300 of them are already hard at work. Obviously, the southern part of the state is where we're getting closer to capacity. The rest of the state is standing by and ready to step in. PPE, protective gear, obviously, there we're a little more dependent upon our friends in the federal government, but that's no excuse. I'm not going to sit around waiting for the cavalry to come in. We have most of our Department of Administrative Services, DAS, the purchasing team there, is scouring the country, scouring the globe, vetting lots of different options in terms of offers, some of which seem a little shaky, frankly, in terms of how we might be able to get protective gear and masks and other things that we need, vents. We placed orders. We placed orders for 1 million N95 and 1 million surgical masks and 3,000 thermometers from what we hope are, trusted sources out there right now. Hope in the sense that seeing is believing. We're looking at the tarmac at Kennedy, waiting to see what we've ordered ready to arrive because we need it. And in the meantime, I just could not be more thankful for the incredible generosity of people across the state in terms of what they've been able to donate. I think it was just yesterday that Mohegan's son donated, close to 1 million gloves. Plastic sanitary gloves, which are desperately needed not just by healthcare workers and nurses, but also our first responders and public safety. I told you a little bit about our initiatives in terms of education, making sure that our kids are not left behind because they're not able to go to school until at least April 20th, because that's the date we pushed everything off to at this point. And I want to make sure that they're learning in a new way. And I got to tell you, our teachers are all teaching in a new way. You know, I mentioned yesterday that thanks to the generosity of the Connecticut Partnership and the Dalio Foundation in particular, that's 60,000 laptops made available to the partnership, an incredible discount, and now we're able to get those dispersed over the next couple of weeks. And there's Khan Academy and Google Class and all the online services oriented to these laptops that are oriented towards our high school students. And today I'd like to say, what are we doing for K through 12 as well? And that is where I'm really pleased to announce a couple of initiatives that are going to make an enormous difference. We were able to negotiate with an amazing online content, education content provider, one of the best in the world, called Scholastic. And Scholastic is going to provide their online content to us at a discount, but it also required incredible commitment from some amazingly generous people here in the state of Connecticut. You know, I've known Ingenuity for many, many years since we went to business school. I knew her when she came to this country, didn't have 2 rupees to rub together. She's so appreciative of what this state and what this country has meant for her and her amazing husband, Raj. And I want to thank the Nuys in particular for standing up and making the donation necessary so we can get the online content from Scholastic rolled out across all of our different districts. That's going to be just incredibly important. It'll be rolled out in association with a number of superintendents, a couple of whom are going to talk today, so you get a better idea of how our superintendents are working in terms of working with our teachers and working with the students, making sure this curriculum works. It's an online curriculum, first and foremost, and what that means, we're working with our major cable providers, Altice, Comcast, Frontier, who else am I forgetting? Charter, and they're all going to be providing free online access for at least the next couple of months. Free Wi-Fi access, doing everything we can to make sure that nobody is left behind. Waiving any late fees if people have had a hard time being able to pay. Not terminating any small business customers for at least the next 2 months. Making sure that thanks to these partners, we're going to be able to provide this amazing online content to our students. And they're already beginning to take advantage of it, and our teachers are already beginning to teach. Maybe I had a great friend of a friend, and he called out to his son who was home from school for obvious reasons, and he said, you know, John, let's get together and do something. He said, I can't. We've got our teleconference set for 10 o'clock. And there are teachers across this amazing state, district after district, who are already improvising and thinking about how they can keep our students engaged. And they're doing that on their own with teleconferencing and Zoom and other types of technology. One of the things that Scholastic is going to provide for us is not just the technology, but also textbooks and workbooks that Miguel Cardona can tell you about. So that those kids that maybe don't have all the technology are also going to be able to utilize what we can. Look, we're going to take what is a moment of healthcare crisis and try to make the best out of this and make sure that our kids have a new way of learning, our teachers have a new way of teaching, and make sure that this is not 4, 6 lost months, but an opportunity to make the best out of a tough situation. And we couldn't do it without the generosity of all the amazing folks, starting with the Nuys, starting with the Dalio Foundation, and a lot of you. Tomorrow I'm going to be rolling out a new charitable initiative. We call it 4CT. Stay tuned. But there are ways that many others can step up and volunteer and help us through a tough healthcare situation right now. With that, I'd love it if Miguel could just tell us a little bit more about this new initiative.
Thank you, Governor. Dr. Miguel Cardona, Commissioner of Education. As the Governor mentioned, it still takes a village to raise a child, and I'm really pleased at the donations that are coming in to support equity and access in Connecticut. My heart is with all of our healthcare workers also, thinking about you. You are our heroes, as are our educators who haven't skipped a beat, who are reaching out to students, connecting with them, supporting their learning, not only academically, but socially and emotionally. That's critically important. Thank you. As the Governor mentioned, even before the COVID crisis, we were looking at equity and access in the state of Connecticut and how we can improve. And unfortunately, right now we have issues of equity and access that we're addressing, and we're announcing that today. Over 60,000 laptops will be distributed to students in need. so they can have access to technology and learning platforms that are already available to them in their districts. But as was mentioned earlier, we're going to have materials delivered to students, books, activity cards from Scholastic that are going to help them learn. And I just want to thank the donors who made this possible, the Nuyi family, Indra and Raj, thank you. You did this in the name of equity, and I appreciate that. Scholastic partners, President Greg Worrell, Chief Academic Officer Michael Hagan, and Account Executive Suki Sergel, thank you. Without you, Suki, we wouldn't be doing this today. And the Partnership of Connecticut, thank you for stepping up for our students. CEO Marianne Schmidt, thank you. The Dalios, Eric Clemens, and the entire board, thank you for keeping our students learning at the forefront. I'm also inspired by the superintendents who, in addition to leading their districts, have stepped up to say, how can I help the state? So we've assembled a COVID Learn from Home task force that will be leading the efforts of logistically distributing these materials throughout the state of Connecticut. The task force members include Dr. Paul Freeman, Superintendent of Guilford, who's co-chair, Mr. Nate Connell, East Hartford Superintendent, who's co-chair, Dr. Michael Connor from Middletown, Ms. Melanie Brady Shanley from Winchester, Dr. Verna Ruffin from Waterbury, and Dr. Eileen Tracy from New Haven. Also, Deputy Commissioner Desi Nesmith and Nick Simmons from the Office of the Governor. We're going to work together to make sure that within weeks we deliver materials to students who are in need of it. And we're going to do so making sure that safety is our primary responsibility and making sure that access is also something that we strive for. Again, it takes a village to raise a child, and I'm proud of the work that's being done to make sure that our students are able to learn throughout this time of crisis in Connecticut. We're going to tackle this access to education aggressively and together. Thank you. I'd like to invite Mary Jordan from Norwalk, teacher from Norwalk.
Thank you, Dr. Cardona. Hello, I'm Mary Jordan. I represent teachers in AFT Connecticut pre-K-12 divisions. I'm also representing the teachers of Norwalk Public Schools, and we are honored to serve the children of our state, and we can only do that because of the hard work of all of those people who are ensuring the public safety and all other types of things that are keeping us safe and healthy and protected. Teachers are grateful to do the work we do. Generally speaking, teachers plan a lot. We work hard to figure out research-based practices and standards of delivery. And this week, we have none of that assurance. We're doing the best we can, and we're grateful for the privilege. We are committed to the students. We are not going to leave anyone behind if we can possibly avoid it. We are calling those who are not showing up online. We are reaching out to every one of our students to make sure that we are maximizing the time available. We thank you for the opportunity.
Good afternoon, everybody. My name is Michael Connor. I'm the Superintendent of Middletown Public Schools, and I'm very grateful that we are prioritizing education in Connecticut, specifically the donations from the Nuyi Foundation, the Nuyi family, the Dalio Foundation, as well as the Partnership in Connecticut. I look forward to joining my colleagues, my fellow superintendents, and being able to leverage equity to ensure that we are dismantling inequities as well as closing the preparation and opportunity gaps that exist in Connecticut. So I'm very grateful to join my superintendents. Thank you, Governor Lamont, as well as Commissioner Cardona, for driving this force to continue putting education, students first in Connecticut. Thank you very much.
Yes, Governor, we have questions for you.
Questions?
Governor, today there was something of a mixed message that went out to Americans. From the White House, the president indicated he sees it's time for people to go back to work, to go back about their activities. And he said that on the same day that Connecticut is erecting mobile hospitals and the governor of New York is saying that there is a dire medical crisis. So would you address how you sort out these two very different messages and where you come down on that?
I come down with the Governor of New York. We have a healthcare crisis. I just told you that the number of infected is doubled compared to what it was a day ago in terms of the daily. We know it's coming up the coast pretty quickly right now. Look, we're going to get through this. This is why I spent a lot of time talking about the next day, the day after, once we're through this. But you're not going to get your economy back on its feet until we solve this public health crisis in a serious way. So I don't want to mislead people that, hey, it's just going to be another couple weeks and then you can get back to business as usual. That's a mistake. I think the federal government has been sending that wrong message for too long.
Governor, how soon do you think you can actually get people back to school, kids back to school? Because the 20th, April 20th is a deadline to look at it again. But realistically, do you think we're going to have school again? Especially with all these new programs you're rolling out.
Well, I got to be careful. I mean, I don't want to predict the future. Obviously, we put it out to April 20th, allow people to, prepare for what I think is inevitable. My instinct is that this is a virus that's going to linger for a lot longer than that.
Governor Ben Goldman with Fox 61. As of Friday, 27,000 people in the state filed for unemployment. 99,000 people filed since March 13th. You call this a health care crisis. Many of these people who were laid off are now not covered under their current health care and insurance. Ohio's governor ordered health insurance companies to extend a grace period that any business would have to defer payments under his order for up to 60 days. Will you be following suit, requiring insurance companies here in the state to keep these people covered in the middle of this healthcare crisis?
Yeah, I'll tell you what we have done. We've expanded the healthcare exchange so more people can get on, and thousands have come on board to get themselves insurance. We're expanding Medicaid to give more people opportunities. You're right. I've worked with all the utilities and banks, doing everything we can to put a pause on there. No foreclosure, give people time. And you're right. I am going to urge, I hope I don't have to order, make sure the healthcare companies, healthcare insurance folks do the same thing. I'm doing everything I can to make sure people have the healthcare coverage they need and small business can power through what's going to be a tough 4 to 6 months.
So you're leaving that decision up to the insurance companies. You won't be ordering that quite yet?
Quite yet is the right way to phrase it.
Governor, go ahead.
Is there any consideration to shutting down Connecticut's borders to stop people, especially from New York, from coming here and then using our resources, or is there?
No. I've heard a lot of the rumors, shutting down borders, shutting down roads. Right now, that's not an option. I talked to Governor Cuomo. I said, look, Metro North is just back and forth. People from New York City, where the infection rate is so high, and coming into Fairfield County, where it's high, and going further up. It's a conduit. What do you do? But a lot of this is self-policing itself, I'd like to think, Christine. I mean, ridership on Metro North is down by, 75, 80%. And at some point, the last people on there are folks who are nurses and doctors and first responders who we need to be able to get to work. But I keep looking at the options.
Yeah, Governor, I'm supposed to step onto the plate here. Sticking to unemployment, there's some lack of clarity about whether people are covered who are self-employed. Is it your view that they are able to get it under some new edict?
It's my view that either they are or they're about to be. I'm going to make sure that we have coverage for folks. I'm working with our congressional delegation to see if the federal bill will include them. But whatever they do, I'm going to extend coverage for the folks here in this state. And in particular, when it comes to paid sick leave, I got to make darn sure that anybody who's paycheck to paycheck, who is not feeling right, may have the flu, may have something more contagious, stays home. It doesn't have to make a choice between a paycheck and staying home. So I'm going to do right by the people of Connecticut. I'll do it myself if we have to do it here. I hope the federal government steps up and does the right thing.
I guess the latest numbers are 12 deaths and 71 hospitalized. Do we have any data on some of these patients, if they had underlying conditions or even their ages?
I believe that 10 of the 12 are over 80. I don't know if I said that before. And it skews towards men. So I learned two things from that. One, older folks, stay home. Just stay home. It's you are most vulnerable, most likely to end up in ICU. It's the most dangerous. But I also, as I remind young people, you may not be fatal, but you are carriers and you can be contagious. And it's so important that you take this just as seriously and you stay home. I know how tough that is for people. I know some of the crowds and the beaches and the such. I've got to reinforce. It's just dangerous for you to be out there. Dangerous not just to yourself, but to everybody around you.
Governor, 4 of the deaths have been at a nursing home and a long-term care facility, one in Ridgefield and one in Stafford. Are you concerned that we have a couple of potential clusters that are going to get out of control? Or is there anything else the state should be doing with those 2 particular facilities?
I am concerned about that. We know that nursing homes can be a petri dish, and they're spreading a vaccine to the most vulnerable population. We're watching this very carefully, and there is a risk of clusters. Renee Coleman-Mitchell is here. I can tell you what we're doing together is going in, testing, making that a priority, especially any place where there's been a contact. Certainly we had 1 fatality. We tested there, segregating out and quarantining anybody there that may be at risk, may be a carrier, staying ahead of that as much as we can. We saw what happened in Kirkland, Washington. You saw what happened in that nursing home there. And we're going to do the best we can, sometimes sailing against the wind, to make sure that doesn't happen in our nursing homes.
Governor, it took 2 days for the State Department of Corrections to admit that one of their staff members, the correction officers, had tested positive. Are you considering releasing any prisoners at this time who are towards the end of their sentences?
Not at this time. I've talked to Roland Cook about it. If we were slow in getting that information out, Christine, I'm doing everything I can to be transparent, and I'll try and make sure that doesn't happen again. But more importantly, we do have extra capacity, our correctional facilities right now. We are going to do everything we can to make sure that anybody who may be at risk of being a carrier is segregated and quarantined in a separate area. And that's going to be my priority before we have to think about releasing anybody. I am told that New Jersey, though, just did a release, so it is something we're watching.
Governor, I think everybody would applaud the charitable donations that we're seeing. What has this crisis shown to your administration as far as the capacity of the state, or things where the state needs to step up? That it does not, for example, the ability to protect for special ed kids during the summer to make up for the remediation that apparently is going to be necessary. But overall, are there any lessons that you've seen at this early stage about the capacity of Connecticut to deal with a crisis like this?
Yeah, I have learned, Paz, that I'm not going to just sit around waiting for the cavalry to come up from Washington, D.C. We'll fight like heck for what is our due, but in the meantime, the people of Connecticut are resilient. We're doing everything I can at the state level. I've been so thankful to the hundreds of people who have stood up, just not making financial contributions, the nurses and others who thought they were going to enjoy a comfortable retirement, getting back in the game right now. I alluded to the fact we're setting up a website in the next day or so for CT, giving more people an opportunity. I think this is the type of crisis that brings people together. And I think it's a type of time where we realize that we're in this together. We're all part of the Connecticut family. And I'm just so happy that folks who have maybe not always been as engaged are 100% engaged now, doing what they can, looking out for their neighbor. Does that answer your question?
Yeah, thank you, sir.
Governor, you were saying that leading up to this moment that things were going to get worse before they got better. Do you have a grasp of kind of where we are now? Are we still at that moment? Things are going to continue to get worse before they get better? Where we may be in the next couple of weeks? Also in terms of policy, do we take a shelter in place? Is that an option that's on the table?
Well, look, first of all, I don't want to depress the hell out of everybody, but you heard Dr. Carter yesterday saying we're still on the escalator going up. And based upon what we saw in Wuhan and South Korea and then Seattle and California and then New York City, I'm afraid this is going to continue for at least another week, 2 weeks in terms of escalating the number of infections. And we're doing, I think, a reasonably good job of slowing that, flattening the curve. You heard Dr. Carter say yesterday that, well, little contradicted by what's going on in New Haven today, but he had anticipated it might be coming faster through the rest of the state, giving St. Francis and our other hospitals an opportunity to prepare for this. Look, I've got to stay at home. I have told everybody, stay at home. I've directed people, I want you to stay at home. I have said, people who are not absolutely essential to be at your office or your place of work, stay at home. I mean, I don't know how much stronger I can say that. And we're going to continue to reinforce that message because I see what happened in places like Italy where they didn't take it as seriously as they should have.
You've opened up Central and Southern. What does that look like? I mean, is this a couple of dorms? Is this, because in their mind, I just want to make it clear so people aren't, so they get an accurate picture of what that looks like and what it would there be hospital beds in there?
Right now, I'm told the priority, at least for the southern part of the state, is let's get a place where nurses and some doctors can stay overnight. They don't have to go back, risk of infection, things like that. But you're absolutely right. We're on with the Army Corps of Engineers today, which is great. They're getting more engaged. FEMA and the Army Corps, this is making a difference now. And we are prioritizing different facilities where they're going to help us figure out how to convert them to, say, intermediate care facilities. We've opened up hundreds of beds by turning those that were there for elective surgery, now opening them up for COVID or COVID-related illnesses or people recovering from that.
Mr. Governor, your interview with WCBS News Radio this morning got a lot of attention from teachers, students, and parents. You suggested that the school year might be over. Is there any timeline for a decision on ending the school year potentially?
Want to take that, Miguel?
Thank you. Yes, the decision to keep schools closed is based on safety of students and of staff. So at this point, we feel that pushing it back to the 20th of April is the best way to move. But we have to plan further. So we're hoping for the best, but we're planning if the entire school year has to be called off as a result of this, we're prepared to do that if it's going to mean increasing safety and flattening the curve.
Is there a time certain where you want to make that decision by?
We're going to do our best to make sure that we're making decisions based off health recommendations. We want to give districts notice. We want to give parents notice. We know that there's a ripple effect. But at the end of the day, we're going to make sure that our schools are safe for our students and our staff before we let them back in.
What will the Miguel, what will the metrics be that you're going to base that on? Are you looking for a peak? And perhaps, Governor, you want to address it as well. Will it be a question of seeing the number of cases peak and actually fall? So again,
we'll take recommendations as we have from the beginning on our medical experts and our Department of Public Health to make those decisions. But ultimately, it's going to be based on safety and making sure that if we're opening up schools, we're doing it in a way that's safe for all who enter.
And Mark, it's a higher standard than peak and starting to fall. We're going to make sure that the virus is behind us, or at least contained. We know we have the safest areas. We know those kids would be able to go back in a safe environment, know they'd be able to go back and not be likely to pick up an infection, which may not be as tough on them, but could be really tough on their grandparents. We're going to be strict on those standards.
And the same is true, I assume, for the commercial closings that you've also ordered?
The same would be true for them. I'm thinking, I told you we made a big order for thermometers. So I'm hopeful that perhaps on the backside of this, I don't know when that is, we can do some testing so folks could be fever tested. Maybe some of the younger folks might be able to get back to work a little sooner, but there's no date on any of that.
That would be fever tested and not doing the COVID test.
All I'm talking about is what I saw going on in Asia as people slowly started coming back into the work. If we had the ability to do the COVID test, that'd be better. I'm not sure we'd ever have that capacity.
Governor, we've had a few viewers write into our station asking about construction sites. They work on construction sites. Construction is continuing in some areas, but as you may know, those sites are really tightly enclosed, and some workers come from New York State and Massachusetts, and they were a little bit worried about being infected, working in such tight quarters with people from New York State, which is seeing so many infections at such a high rate. Any other guidance that you might be offering coming
Yeah,
down
I'll
the
tell
pike?
you, we're going to watch that carefully. Obviously, the big outside construction projects were a real priority. You know, whether they're doing the Charter Oak Bridge or 2 or 3 schools, big projects that have a duration to them. We want to get them up and operating, ready to go on schedule. But your point is well taken. If all construction sites are not created equal, some of them are smaller, some of them are tighter. I can only prescribe so much, and probably I ought to prescribe that. In the meantime, I've just urged people, use your damn common sense, will you? If there are 5 people packed into the place working, go home.
We have 1 million orders for masks coming in. Do we have a tally on the number of ventilators that we have in the state right now?
Do you know the answer to that? We are scouring the globe for ventilators right now. We're scouring the globe to retrofit ventilators that may be used for a different purpose. We're working with the CDC and others, seeing if we can maybe serve 2 people off of a ventilator. And I think I've filibustered enough.
Good afternoon, Commissioner Coleman Mitchell from the Department of Public Health. We're getting loaners, we're getting donations for ventilators, which is a good thing. And right now we've put together at the department a task force specifically to address all the types of ventilators that we're getting so that we can make sure that they're functional and that they're safe. And so the numbers continue to grow.
Just asking because New York released an eye-opening number of the lack of ventilators that they have. So I'm wondering, do we have a number here, like a running tally in Connecticut?
We have literally, it is a running tally. We have hundreds and hundreds. We asked for an additional 1,000 ventilators just a couple of days ago. We put in an order for 500 about a couple of weeks ago. So we've added more in terms of that order, another 1,000 we've added for the request.
A question while you're still up, it would probably be for you, it may be for the governor. The Westport party, it appears there were more than 100 people there, not 40 or 50 as had been reported until today. Does that affect the way the state health people would have responded to that? Would that have changed? It apparently we're just sort of figuring it out now, but apparently the local health department was only told that there were 40 people at the party. I mean, only told that there were 40, and there were a lot more, maybe 3 or 4 times more than that.
What I can tell you is that we continue to message that social distancing right now is the best thing that we can do in regards to slowing down this virus.
Yeah, the question is whether that would have changed, and it may be for the governor, whether that would have changed the way the state responded.
Governor?
No, I would say don't go to that party. Don't have a party like that, whether there's 40 people or 100 people. I know I put a cap of 50 people at one point, but don't be dumb. Stay away from groups like that. You can go to 5 groups of 10 people each, and that's the same as 50 people over a course of time. You've got to limit those interactions, whatever the size of that group is. This virus is incredibly contagious. It's been shocking how fast it's running through the body politic right now. And so I just urge you, the smaller the group, the better. Stay home. You cannot be too safe. Not where we are right now. Not with this infection peaking the way it is across our state. I cannot urge you enough. It's not a question of social distancing or 5 feet. It's a matter of staying home, whatever the size of that group could be.
Contact tracing, Commissioner?
My instinct is a lot less of it, certainly down in the southern part of the state where you have a community infection now going on. Maybe we're doing some still around here that you know about.
So your first question regarding contact tracing. The Department of Public Health has a number of epidemiologists who initially have been doing contact tracing, knowing that as the numbers increase and the contact numbers increase, that eventually we would not be able to continue to do that. We also are working with our local health directors, and a number of them have signed on to say that they have the staff and resources to do that as well. So as I currently stand here before you, I can say that there is some contact tracing going on, absolutely. But as time continues and the numbers continue to grow, that is going to be a point where we won't be able to keep up with the demand and the numbers.
If I could follow up, what are the circumstances in which you are doing contact tracing? What are the areas in which you see that need or that it would be productive to continue to do that?
Generally speaking, from a public health perspective, epidemiologically speaking, it's always good to do contact tracing, right? But some of the things that we're dealing with is that the numbers are immense in regards to the contact tracing in itself. It's also imperative to recognize there's a number of staff resources at the state level, but again, it's just a set of resources, staff resources. And it also is incumbent upon local health, if they're able to, with their resources, to able to do staff contact tracing at their level, then they can. So it's been varying in whether or not the staff resources are available or not. We do. I can forward that to you.
Governor, do you have any comment about, in Congress, there is a holdup on the aid plan, the $2 trillion aid plan, because apparently the Democrats want to see a whole lot of agenda items involving the environment and other social spending that doesn't necessarily go with this package. Do you have an issue with that? Would you like to send them a message?
I don't know if that's what the issue is. I can tell you on behalf of every governor I've talked to on both sides of the aisle, we sent a letter. Don't give the money to Treasury and let them dole it out to whoever they think is needy. Give it to the governors who can set a priority of where that money ought to go.
Governor, just want to get a little clarification. I'm getting messages as I stand here. We've 99,000 people on unemployment since March 13th. What will be the decision maker for you to not urge, but require insurance companies to keep these people to have a deferred premium payments and extended grace period like Ohio and even Governor Cuomo in New York has now done?
We're going to take a look at that very carefully. Thank you, everybody.